Hi, I'm here with Sarah Clark from the Old Mill Foundation. If you'd just like to say a little bit about your charity and what it is that you do and what you offer.
Okay, hi, I'm Sarah and I run the Old Mill Foundation and we're a cancer support centre. So we do this holistically, offering a range of complementary therapies, manual lymphatic drainage, diet and nutrition, a cup of tea and a chat, and we do this for people for 5 years from the all clear, and that's what we do.
And what made you invite me down here to do some scar tissue training with your therapist?
So we were already doing a little bit that we learned many years ago, but it was very limited moves, and I happened to see an advert, I think in the FHT magazine, I think it was, and so we did the 1 day with you.
Yeah.
And since then we've had just incredible success with a lot of people, especially those with lymphedema in their breast.
Okay.
So it's been releasing the lymphedema, and so that takes a lot of pressure off us as well as MLD therapists, because there's very few of us. So this means that we can get a lot more people trained in the scar work, and it's just invaluable, I think.
Yeah. And how do you think the training has gone here? So we had about 11 of your therapists, I think, come along.
We did. They've all thoroughly enjoyed it, been amazed by what they've seen just during the 4 days. Well, blown away, in fact. And a couple of people did come as sceptical, and so they've gone away very positive about it all, and they all can't wait to get started.
And I think one of the things that particularly the people coming along to have treatment who'd perhaps been invited by the Old Mill or come in who are friends and family of the therapist, because it's something that we don't hear a lot about, is people having treatment on their scar. It was really interesting for me, as always, to see the reactions that we get from people. How would you describe the kind of client experience that they've had as even as volunteer models, let alone being in a clinic session? So these are people who've come along to the training and they're having treatments in a classroom situation.
Yeah, I think they've all been thrilled and again amazed by the results. So a lot of them came in not actually thinking they've got a problem with their scar. I think that's the biggest thing. A lot of them came in and said, well, I've got this scar, but it doesn't really bother me.
Yeah.
But then when you start talking to them and you realise other problems that they've got, and a lot of them have turned out actually to be linked to the scar.
Yeah.
And so by working on the scar, we've helped to relieve those other problems. And of course, nobody makes that connection normally. Yeah.
Well, you have to let us know how you get on at the Old Mill. It'll be really good to see how the results are. And I know that you were saying already you're getting really good referrals in to use your service by the breast sort of consultants and departments locally, but obviously there are lots of other departments around who could be benefiting from your services. Yes. Who are the type of people that you're hoping you might be able to reach out to who aren't perhaps getting that access, or perhaps another service you've set up locally that isn't quite being utilised well enough?
Yeah, I think the big thing is referral from the NHS, because people have a lot more faith. And McMillan, people like McMillan and people like that. Yeah. So in Port Talbot we're quite slow because we haven't got those connections yet, because they haven't seen people coming back. So in Pencloud it took a lot of years, but it's because they see the results of what we do now. And so they have a lot of confidence in what we do at the Old Mill, so they refer. So that will start to happen, I think. And also, so the first few years was breast cancer, because breast cancer came to visit us, because they set up a whole new unit for breast care support in Singleton Hospital, and the whole department came. So they saw what we did firsthand. So it is rippling out. It's just taken many years, and so now we're getting more patients with kidney cancers and things, and we had a couple of people today with scars from that. And we're now doing talks to head and neck cancer, so we're getting a lot of head and neck referrals as well.
Yeah. So, and they can be quite complicated, so actually being able to benefit them can be
and scar again is going to be invaluable for head and neck cancer patients because of all the radiation that they've had. So it's going to be amazing.
We shall watch this space. Thank you very much, Sarah.
You're more than welcome.